Hi, I'm Gail Miller. Welcome to my Aged Care Mythbuster series. Today we're busting aged care myth number 11. It's that if I move in with Dad, he won't have to sell his house to go into care. I'm sorry, but that's not right. There are really stringent guidelines about the financial aspects related to people going into aged care. One of them is that you have to have been living in the house for at least 5 years and you have to have been providing a designated carer role. If you just move in, hoping that in 12 months' time when Mum or Dad may need to go into care, they won't have to sell their house because you've been living there for a while, that won't fit the criteria. So if you sold your own home in order to move in with them, then you may find yourself without a place to live. So it's really important when you get to this stage of having to make decisions about how their finances are structured and what needs to happen if Mum or Dad need to move into aged care. It's really important to get the right aged care financial advice. A regular financial planner hasn't done all the extra exams required by an aged care accredited financial planner. So it's really important that you find out if a financial planner says that they can help you, make sure that they've got the aged care accreditation. If necessary, actually cite the document that says that. I actually have built up a database of professionals all around Australia so I can help families who are anywhere in the world if they've got parents here in Australia. An aged care financial specialist that I was chatting to recently, who's in Queensland, was telling me that one of his clients had seen a financial planner who said, I can sort all that aged care, entry stuff out for you. They came to see the guy that I was talking to after 4 months, when the financial planner actually handed it all back to them and said, this is all too hard, I can't do this. So straight away they'd lost 4 months. It took this aged care accredited financial planner 3 weeks to sort out the mess. So the family, by the time he had actually managed to work out the finances, they had lost nearly 5 months. That's a huge amount of time. Had they been to see an aged care accredited financial specialist in the first place, that wouldn't have happened. Imagine the anxiety that family had to go through. So it's really important to get a bit of advice first. An aged care placement consultant I was chatting with in Melbourne last year said that she had a client who insisted that she couldn't go into care because she hadn't sold her house yet. She was 92, still fully cognitive, making all her own decisions, and she insisted, I can't go yet, I have to sell my house. The placement consultant said, I'm not sure that that's the right strategy for you. I want to get some specialist financial advice, which she did. When she got back to the lady, she said, no, you need to move into care now and we'll sell your house in 3 months' time. The lady did that. That strategy saved her $750,000. Perfectly legal. It was all done exactly the way the government guidelines set out. But can you see how a different strategy had a different outcome? Okay, so it's really worthwhile spending some money and getting the proper financial help. I can actually help clients with that. So if you've got any queries, reach out to me. Please stay tuned and we're going to bust aged care myth number 12 very shortly.